As part of Yahoo Finance's week-long healthcare special, we're taking a look at the progress in mental health support. Roughly 50 million Americans in 2019 and 2020 were experiencing a mental illness, according to Mental Health America. But as interest rises in mental health wellness, we're digging into how workplaces are handling the new age of mental health. To break down the latest progress and barriers in the mental health space, Yahoo Finance's Anjalee Khemlani spoke with John Crable, Corporate Synergies Group Senior Vice President. Take a listen.
I think some of the social stigma has gone away from, the whole concept of individuals saying that they could use support or help. And I think that there's a greater demand from the employees to their employers to provide additional resources and avenues for support and help.
We've seen definitely the rise of things like apps, wellness apps in particular, or telehealth visits through virtual means, and connecting in some cases to in-person appointments. What would you say is the most valuable thing for employees right now that employers could do?
Well, I think you really outlined it, which is to provide kind of a multi-pronged approach for employees to access mental health support and resources. So that could be, apps like Calm or Headspace that allow employees to, kind of self-manage, but also it's really giving them access. It's creating avenues to talk to mental health care professionals and providers.
When it comes to the expense of this right now, we're talking about this in an era where increasing premiums, increasing employer burden of that continues to be a topic of conversation. I'm sure you're hearing that as well. And so I wonder how adding all these additional services, contributes to that bloat conversation.
Yeah, that is a good point. And that's a challenge that employers face all of the time. They all generally provide basic, healthcare and prescription coverage and maybe some other lines of coverage, but really kind of bolstering that with mental health support and other things is very important. The good news is that with some of the online, the digital platforms, as you mentioned, and virtual care, the cost is more manageable. And also we're seeing a greater investment from the healthcare carriers themselves. The big insurance carriers are also expanding kind of their offerings and support, recognizing that this is, an area that is in high demand right now.
Do you think that there are still too many avenues where there's no coverage right now? Are the offerings kind of limited maybe into what is available?
I think the biggest challenge that employers and individuals face in either providing or obtaining mental health care support are the providers and the limited providers. The good news, again, is that the digital platform allows quicker access because you now don't have to work specifically with a provider in your exact geography. You could meet with someone on the West Coast if you're on the East Coast. But that is certainly still a challenge.
And then finally, when we're talking about this space, obviously leaning heavily into the digital side of things, a lot has been sort of employer pilot programs or, trying to get the buy-in of the employers. You mentioned that we're getting more buy-in from the traditional players. What remains the barrier there to maybe more adoption? Is it just the scale that these platforms are able to provide?
Yeah, I think you really touched on all the challenges, which is, associated cost, right? So there's that. There is the ability to provide access. And I think the other one is still, helping their employees get over the stigma, because they can offer the product, they can offer the programs, they can offer the platforms. But if the person is still not comfortable saying, hey, I need help, or, I just need to talk to someone, then the employer can offer everything. If it goes unused, then obviously it's not supporting that person.
That was John Crable and our own Anjalee Khemlani as part of our healthcare series. And be sure to tune in tomorrow for more of Yahoo Finance's special Healthcare Week.